You're watching continuing coverage of the World Healthcare Congress 2012 in Washington, D.C. It's estimated that some 35 million Americans suffer from depression, and that translates into real cost concerns for American workplaces. I'm here now with Kathryn Goetzke and also Bill Wilkerson of iFred, which is the International Foundation for Research and Education on Depression. Welcome.
Thank you so much. It's a pleasure to be here.
Now, that's a lot of people we're talking about, 35 million Americans. How many of these folks are treated?
It's actually less than 25% of people with depression are currently being treated. So that's 75% of people with depression are walking around not being treated right now. And it's
astounding.
10% of the workforce as well. So a significant portion of the workforce is going untreated for depression.
Why is that?
It's the number one reason is stigma. So, and when we talk about stigma, my background is in marketing and advertising. We talk about negative brand. So it's basically the notion that this is depression. This is how it's pictured through imagery on news stories and whatnot. And so we really need to change depression to be something positive, hopeful that people can get treated for, because it's treatable.
Okay.
It's a disease state, yeah.
Now,
it's treatable.
Fred, you're from Canada and
Yep.
you're involved with this company. We're talking about Americans here, but this is an issue in Canada as well.
Very much so, and the reason I'm here at the Congress is to reflect the support of the Canadian business community for Kathryn's initiative and her efforts. We've had significant progress in getting Canadian corporations to invest in the mental health of their employees and to take steps that will reduce chronic job stress, which is a risk factor for depression, and also to help their employees know and understand that depression is a factor in the course of heart disease, is a factor in the course of diabetes, and has a profound effect on the general well-being of the working population. The cost today in the United States, Canada, and Europe combined is $1.3 trillion a year, $400 billion in this country. This cannot be ignored. That's 4% of the GDP being consumed by an ineffective handling of a major public health problem.
And it's treatable. I mean, so depression is treatable. The only reason it's not getting treated is because people are afraid. They're afraid to say they have depression. There's research that says they'd rather say they committed a crime than they have depression. They don't understand the biological components of depression. So when we're talking about over $1 trillion, these are things that we could actually be saving this money if we just were to address the problem.
Is there any evidence at all that American companies are starting to recognize that they need to address depression like they would any other disease?
Well, that's exactly why we're here. We're here to start the conversation. I mean, companies...
It hasn't been started yet?
Not significantly. To speak a word of hopefulness, which is Kathryn's theme, which we need to embrace mightily, is there will be a CEO roundtable on brain health that is in the stages now of being formed. I'm in New Jersey this Thursday to help further that. Yesterday we spoke to the CEO of Xerox, who was speaking to the Congress, and she's very supportive of investments in the mental health of her population. So it's hopeful, and we can do it. To business, though, you talk nose to nose, not heart to heart. You got to make the business an economic case.
And if you think about it, too, we just passed mental parity legislation, which means that brain health can be should be treated the same as physical health in insurance companies. So, I mean, there are high copays with mental health issues. They put a limit on the number of visits people can go and visit a mental health, a psychiatrist or psychologist. And those are things, if we were allowed people to get screened in primary care doctors and then treatment, and unlimited treatment to where they were better, we could save significant costs. And it's been proven in research that a company can save $5,000 to $10,000 per employee if they were simply addressing the problem.
Can I add one thing? If the case for investing in depression can be made effectively, it can be made effectively in support of our kids. Depression unveils itself usually 12, 13 years old. We didn't know that until about 5 years ago. 75% of all adults living with the symptoms of depression developed onset in their early teens, their late adolescence. Today in this country, in the United States, the equivalent of 10 jumbo jets full of kids crashing and burning and killing all on board is the number of young people, adolescents, who take their own lives due to depression. We got to stop that and stop it fast.
Yeah.
Those are powerful statistics.
Yeah, I know.
Thank you. Thank you very much. Well, we appreciate your time today, both Kathryn and Bill.
Thank you.
Thank you so much.
Thank you. I'm Mabel Jong. Thanks for watching.